Welcome to the Aortic YouTube channel. You're watching the African Cancer Research Corner. I am Professor Fulakemi Odejina, one of the scientists anchor for the channel. I also have the privilege of serving as the chair of the Aortic Research Committee. I really am very excited about today's program, as we are going to be talking with members of an organization that has looked at cancer research funding in Africa, the International Cancer Research Partnership. My all-time favorite topic to talk about, funding for cancer research in Africa. Please join me in welcoming Drs. Kalina, Duncan, and Dr. Lynn Davies. So we are going to get started with Dr. Kalina. Duncan, can you introduce yourself and your organization to our audience, please?
Yes, thank you so much. It's wonderful to be here and great to talk about this very important partnership and how we can work together to improve cancer research funding in Africa. I'm Kalina Duncan. I am the acting branch chief for partnerships and dissemination at the Center for Global Health at the U.S. National Cancer Institute. And we are a partner in the International Cancer Research Partnership.
Dr. Davies?
Hi, my name is Lynn Davis. I'm the operations manager of the International Cancer Research Partnership. And to tell you a little bit more about ICRP, it's an organization of partners who represent over 140 cancer research funders worldwide. It started in 2000 and was initiated actually by the US National Cancer Institute and the US Department of Defense. And they invited a lot of other organizations internationally to join in with this effort. And it's grown now to have over 140 organizations participating, mainly in Australia, Europe, USA, Canada, Japan, and that is a sort of growing network of individuals, and we're always looking to grow the network to ensure that people can collaborate effectively. So ICRP is really a forum for cancer research organizations to discuss strategy and management of cancer research. And in order to be effective at collaboration, you need to understand what research gaps need to be filled. Funders need to know what's being funded already to identify what gaps there are, and then work together effectively to address those gaps. So in order to do that, our partners, in addition to talking every month on webinars and conferences, they contribute their research portfolio data to our ICRP database. And as of today, we have over 218,000 current and historic projects in 4,000 institutions across the world. And that actually includes over 1,000 projects in 12 African countries funded by our current partners. Although we don't have any partners who are contributing data in Africa as yet, we would really like to see that change. So the projects that we have funded in sub-Saharan Africa, mainly in 12 countries there, are funded by 28 non-African funders. And we've started to analyse that data to see what the patterns are. And we're also very, very keen to work with local partners to ensure that we can get a really holistic view of cancer research funding in Africa.
Yeah, this is really very interesting, and then we have a lot of viewers from scientists to organizations within Africa. So I guess most probably some of our audience will be asking the question: what does it take to be a partner of ICRP? So what does it take, and for organizations that may be interested in being a partner, what would they need to do?
So our partners effectively contribute data and time, and we're very keen to work with organizations to provide a simple way of contributing. So most of our partners send through their portfolio data on an annual basis to say, what projects are you funding? And we code all of those to different types of cancer and types of research, so that at an individual level, you know per project what types of cancers are being investigated, and also what type of research that is. So an example would be, point of care cervical cancer diagnostics that would be found in our database under cervical cancer and diagnosis as keywords.
That is fabulous. So you're listening? to Dr. Davies, and you know that there are quite a number of funders in Africa. So I think it's time for you to step up. Let's see your data and let's see what you are funding in Africa. So going to the next question, why the focus in Africa? Why is it so important to be able to document what is going on in Africa?
I think for any region, I think it's really important that everybody understands exactly what research is ongoing so that you can really think strategically about how to invest limited resources in the right places. And obviously we're very keen to be working with Aortic and with other organisations too to make sure that research findings are disseminated widely, and to that end, we've been very, very pleased and happy to be involved in discussions about implementation science in the region.
Yeah, one of my passion, implementation science. So what are some of the accomplishments so far in Africa that you've seen?
So I can jump in here if you'd like, Lynn. So I think that, as Lynn said, it's so important to get a global understanding of where cancer research is taking place. And, one of the first questions as an organization within the US National Institutes of Health, when we are talking with partners and collaborators in a region or a country, one of the first questions that comes up is who else is working here? And what are they doing? And is this duplicative? And what gap can we fill as a partnership working towards, cancer control? And so I think that having data on the ICRP about who is collaborating with partners in Africa, who is funding research here, I think that in and of itself is an accomplishment. And I think the overall goal that Lynn has alluded to of getting more partners as a part of this effort and having a very holistic view can really help inform decision-making. It can help inform funding priorities. It can really give us as a global cancer control community the ability to do a really comprehensive analysis of what is being done and how we can do it together. So in some sense, data sharing is sort of a strange midterm accomplishment, but I actually think understanding that full global picture is quite challenging. And it's certainly an accomplishment of the partnership thus far and one we really hope to build on.
Mm-hmm. And I quite agree with you that is so important, especially for the research community, because, sometimes I've seen colleagues who are actually part of the same institution and they find themselves in the same country and they didn't even know they were working together in that same country. So having that data available will really sort of, elevate and synergize cancer research in Africa, and truly an important thing to have. So, it sounds like you're doing a lot, providing this data, and is within the reach of the science community to be able to sort of move forward and use the data. What do you see as the potential, greatest impact of this relative to looking at the global cancer disparities as far as Africa is concerned?
Kalina, do you want to go first or shall I?
Sure, yeah. Sure, I think, so I think one of the things that with this kind of knowledge and these kinds of data, one of the things that is very important to us is actually connecting researchers and research partnerships to programmers and policymakers in countries where it's going on. And this is something that doesn't always happen. Sometimes research takes place in a vacuum and doesn't get translated into effective policies and programs that can help cancer patients and general populations. And I think that's one of the big goals that we have at NCI, is ensuring that the research that we are funding and the research that is taking place in collaboration with partners around the world is translated into evidence-based policies and programs that hopefully result in an addressing of cancer health disparities in population level health policies that really bring sort of everyone up in terms of the health of a country. And ICRP helps us do that by knowing who is working where, and how to populate those networks and bring people together.
Yeah, absolutely. Just agree entirely. And I think what's been a really positive experience for me working for ICRP and for our partners is, being able to set up those collaborative ideas with you, and we've been working with Dr. Solomon Rotimi on mapping out who exactly are the cancer research funders in Africa, and that's been really positive. I think we have to make these small steps to try to understand clearly what research is happening in the area, and as Kalina says, to be able to ensure that that's translated effectively then for the benefit of patients in the region.
Yeah, and that is so clear. This is one of the reasons why it's so important that, all these organizations, associations need to really work together to be able to just go on and attack the main thing that we are all fighting, which is to conquer cancer in Africa. You did mention how it filters down to patients, and some of our viewers are actually patients and patient advocates. Can you give an example of how the work that you're doing in the area of funding would really elevate patient care? And you did mention, I don't know whether it was you or Kalina that mentioned implementation science earlier on, but how do we then turn this around to be able to really influence or to be able to have an impact on patient care in Africa, which is really the ultimate goal that we have?
I think certainly, what we want to see is seeing the knowledge that is being generated in some of the projects that are being funded at the moment being translated to every area of the population. I mean, I think we mentioned earlier that we are aware of projects like point of care cervical cancer diagnostics. Also, another one that comes up within our portfolio is cost-effective radiation delivery in low to middle income countries, for example. And, it's so important then that we have networks of funders working together who can then ensure that the results and outputs of those projects benefit everybody in the region, not just a small number of people within a particular locality or country. So I think that's where the networking aspect and the connections of funding organisations is really vital, to be able to share that expertise and ensure that people can co-fund together. So, that's all what our network has been all about, is trying to get cancer research funders to talk to each other, to understand what their common areas of interest are, and also, to think about co-funding. So we have various partnerships that have been developed. A very recent one that was announced yesterday was the World Cancer Research Fund working with Cancer Australia on prevention initiatives there. So that's where we want people to really work together as funders in different countries, different continents, to address problems that are common to them.
Yeah, and I think, one of the things that I really like about your partnership is the idea of, if you think as funding as a puzzle, right, and you are filling different aspects of the puzzle, you can actually see where the gaps are. For example, one of the things that we just recently worked on is looking at clinical trials funding in Africa. And it's amazing to see how clinical trials funding is so skewed to some regions, right? And it's skewed to some types of cancer, and it's skewed by some kind of funding agency. And that sort of gives the visual, based on your partnership, that, okay, look, a lot of you are funding maybe in B category. Can we spread, given what we know about Africa, can we spread the funding into other areas, or can we spread the funding into other diseases? And I think this is one of the reasons this is also tied in with the issue of policy. And you can use this for the government in each of those countries to understand where they have the data and where they don't have the data. So it's sort of really exciting to me. Another thing that I think, just thinking back about the partnership, are you mainly, are you including most probably pharmaceutical companies or other funders that are not traditionally governmental or NGO? Are you thinking about that, or that would be another different round? It just kind of occurred to me, so I'm throwing that out there.
It's a really good question, and it's certainly something that we would like to develop potentially in the future. To date, We haven't found it to be too easy to get information about the specific projects that are underway within pharmaceutical companies, and I guess for obvious reasons. But it, it's certainly information that would be useful to acquire, and we'd hope that having developed the networks of collaboration between non-governmental organisations and governmental organisations, that provides a potential platform for people to have that discussion then. And it's interesting as well, mentioning the profile of cancer research that's happening, and that's one of the things that we've looked at within the data that we do have, about over 1,000 projects that were funded over a period of 4 years in sub-Saharan Africa. And in contrast to the international portfolio, where the strong focus is on breast cancer, colorectal leukemia, we could clearly see that those projects were much more strongly focused on the virally induced cancers, on cervical cancer, non-Hodgkin's and Kaposi's, which perhaps is no surprise, but that's exactly the kind of information that it would be great to be able to see on an African basis, to really understand what potential gaps there are, and as you say, whether funding needs to be spread across a number of other cancer sites, and in fact whether the funding aligns with the incidence of those particular types of cancers and the clinical need.
Absolutely, that is so huge and so important. So my next question is from the data that you have on cancer research funding in Africa, what do you think should be the focus for organizations such as our organization, the Aortic organization?
Well, we would love to be working with Aortic to really complete that picture of cancer research funding in Africa. As we mentioned, we've got information about what some of the funders outside Africa are funding within the region, based on the region, but we would really like to see funders in the area contributing their data and helping to shape the direction that we take in terms of analysing that data, because, locally, people know best, don't they? And they understand best what the context is. So we'd like to help to facilitate those discussions. Absolutely,
I think is very important. And as I can only speak for Aortic Research Committee, as a committee, we definitely look forward to to partnering with you on that. So related question is, how do you envision partnering with Aortic to increase cancer research funding in Africa? Because there's really the struggle for the scientific community in Africa. Majority, for the colleagues that I know, majority of the funding is coming from outside, right? And in fact, when you even look at philanthropic organizations, there's not a lot within Africa to be able to fund this. So, and that has been one of the things that the Aortic, kind of thinks about. How do we increase within Africa funding? Is there some suggestions on what we can do, on how we can partner to do this? This is the $1 million question.
So I think an area that comes to mind when you ask that question is cancer research training, and that important sort of marriage of funding of cancer research, and especially when that's done in partnership between African countries and other countries, and the critical nature of training as an integrated part of those cancer research programs. And I think from the data that we have in ICRP so far, we know that there are fewer training programs funded, or fewer programs that are coded as training, than research programs. And I think an important part of this is increasing the number of research training opportunities, research training funding grants that are coming out of our partnership organizations, because ultimately that should increase the number of research grants that are funded and the number of funders who have applications coming in from the region and the continent. So I do think that the data that we have can provide some important insights into cancer research training. And I think that is a really critical focus area for us globally. But I think from working with partners in Africa, I think increasing opportunities is a message we've heard loud and clear, how we can potentially help increase funding in the region.
Absolutely. So much on point. I know that you're currently working with our organizations on some activities, but can you describe some of the activities that you are currently working on? And it doesn't have to be the one that you're working with AOTIC alone, but what are some of the things in the pipeline that you currently have?
In terms of ICRP, then obviously we've been working with AOTIC, as we mentioned, on mapping out who the funders are and hopefully then being able to get to the point where we can tell exactly what funding is going on. And I think that's going to be really important in terms of addressing your previous question as well, is making the research in the region more visible. And that in itself then can lead to collaboration either within nations in Africa or internationally to address specific research questions and find funding partners for new projects, whether those are research or training or more clinically orientated projects. So I think that we're really excited about doing that. And we've also been working with the SERGO group to look at implementation science and helping them to understand some of the landscape of cancer research. And I hope that we can have all of these initiatives kind of melding together and working together. ICRP in the first instance was all about avoiding duplication and making cooperation between funding agencies the norm. And I think that that's what we've got to do with all of the various initiatives that are going on, just making sure that everybody is talking to each other and that we're all focused on the common goal, which ultimately is patient benefit.
Mm-hmm. The science community definitely needs to borrow that policy from you so that we are all working together and not competing, duplicating the efforts in Africa and everybody trying to do their own thing. I think that's just the future. That's the only way that we can conquer cancer in Africa. Is there anything else that you both would like to say about ICRP and your closing statements from both of you?
From me,
I'll start.
Oh, yeah, you go ahead.
Good to end with Lynn. So I will say from the NIH perspective, we are so happy to be a partner within this organization. And we really believe that understanding the entire global research portfolio and what is being funded is critical to prioritizing and to, creating initiatives in the future. And I think one theme that came up throughout our discussion today is the importance of implementation science and implementation research. And it's been wonderful to begin to work with AORTIC on this topic and understand how we can bring this to the next level for all of us, I think. And so I hope that we can continue that discussion. I think the ICRP data provides a great foundation, but I look forward to the annual meeting and to continuing the discussion around how we can all partner to further implementation science and cancer control. Lynn, over to you.
Thank you. Yeah, I think for me, seeing an increase in the number of organizations that submit their data to ICRP is always a very, very positive thing, because that's the foundation stone for understanding what is happening, where the gaps are, where we need to fill those, and more importantly, how we work collaboratively as organizations to put that jigsaw puzzle together. And I think that what's really been exciting is whenever we've seen a new country join and start participating in the conversation, everybody learns something new from each other. And there are great models that can be shared across nations, and I'm sure that AORTIC and the cancer research funders in Africa would provide a very balanced view of what's going on in the region and help inform other organizations internationally as well on areas of best practice.
Wow. Thank you so much. I have learned so much about the ICRP today, even, much more than when I attended the African Cancer Echo program and you gave that presentation, Lynn. It's been the start of a beautiful relationship, and great to see the relationship between AORTIC and ICRP just develop. So thank you so much. It's been a great pleasure spending time with both of you and learning about ICRP. To our viewers, thanks for joining us today. Remember to subscribe to AORTIC YouTube channel. It is free. and consider becoming an EOTIC member today. Thank you, and until next time, bye.